Hey guys, I'm Dr. Chris Timms, GP with an interest in skin cancer medicine. Today, I'm going to be showing you what a punch biopsy is. So recently, Hugh Jackman came out on social media and said that he'd had a few punch biopsies looking for a potential BCC with his doctor. So what is a punch biopsy? So we do a punch biopsy to take a small, discrete, round area of tissue to send off to the lab for diagnostic purposes to determine if something is, for example, a basal cell skin cancer or something else. And we use it to guide further management. So for example, if it comes back as cancer, we know we need to do further excision or further treatment. It's different from an excisional biopsy, which is where we'll go in and just cut the whole thing out with good healthy margins. So today, for demonstration purposes, we'll be doing a punch biopsy on this, as well as this koala who's volunteered. During a skin procedure, I'll often have someone else in the room with me handing me things or obtaining things that I can't touch when I'm scrubbed because I want to remain sterile. So in order to perform a punch biopsy, we need a couple of things. We need a sterile field, we need local anesthetic. For this procedure, I'll just be using sterile water to demonstrate. So we draw up 3 ml of the required solution into the needle. Again, I'm just using sterile water to demonstrate it. So identify the site of concern, insert needle, inject. Once the lesion is nice and numb, you'll then want to use your punch tool. Using the punch tool, test to see if everything is numb, and then take a core. Small core comes out. That is sent off to the lab in a histopathology pot that will be, of course, labelled. And you can see there. And that's really it. A punch biopsy is a very quick, effective way of testing a piece of tissue. Now let's say our vegan rice crackle koala needed a punch biopsy, but I needed an additional sized tool during the procedure. Now I'm technically scrubbed, so I'll need someone who's helping me to obtain the tool from the kit. All right, thank you, Larry. You're most helpful. So this is a 3 ml punch tool. And that's it. Punch biopsies are very simple. They are different to excisional biopsies or incisional biopsies. In a real patient, we would obviously use our sterile treatment bay with sterilizing solution, and we would maintain full sterility using sterile gloves, as well as no contact with external sources of contamination once the surgery had started with a full scrub. But for demonstration purposes, this is what a punch biopsy is. And it's a very simple, quick way of obtaining tissue. Always best to talk to your doctor, however, and not to attempt this at home by yourself. And it's one option in a couple of options you've got when you see your skin doctor. Hey guys, I used a sterile water just to demonstrate today, but normally we would use a numbing agent